have heart failure, staying active is a critical part of caring for yourself and staying well. However, staying active is often harder than usual for many people living with heart failure, as the condition can make you feel tired quickly. Most people also have questions about whether there are any activities they need to avoid. I will go over a few necessary adjustments to ensure you are exercising safely. I'll also share some tips on how to make your own heart failure exercise plan and where to get more help and coaching. What are the benefits of staying active when you have heart failure? Physical activity and exercise can help you sleep better, feel less tired, lower your blood pressure, strengthen your heart, muscles, and bones, feel more confident and in control, and reduce stress, anxiety, and depression. What can you do to stay active safely with heart failure? Some people will need to exercise under supervision or make a safety plan for a possible medical emergency. Check with your healthcare provider before you make any major changes to your physical activity levels. When you live with heart failure, it's especially important to pay attention to how you're feeling both before and during exercise. Check your heart failure zones before you start. Exercise only if you're in the green zone. If you're in the yellow or the red zone, reach out for medical help and don't start exercising. If you're feeling sick with a viral illness or infection like a cold or flu, take a break from exercising until you recover. During exercise, keep paying attention to your body. If you feel any of the yellow or red zone symptoms, stop and rest. Sit down in a chair or bring yourself slowly to sitting on the ground. If you still experience symptoms, even when you rest, call 911. You can also use the talk test to measure the intensity of your exercise. That means as long as you have enough breath to talk, but not enough breath to sing or whistle, the exercise intensity is okay.
How do you make a heart failure friendly exercise plan? We recommend you ask your healthcare provider for a referral to a cardiac rehab program. Cardiac rehab is a group fitness class for people with heart disease that's coached by a qualified exercise professional. Many people find it supportive, rewarding, and motivating, and often make big strides beyond what they've ever expected. It's also a great opportunity to connect with other people going through similar experiences and build friendships. If there are no programs in your community, you can still get active. Talk to your healthcare provider before you make any changes to your activity levels. If you're getting instructions from an exercise professional, tell them about your heart failure. I'm going to walk you through the main points we teach in cardiac rehab so you can get familiar with some of them and use them to make your own exercise plan. There are three main types of physical activity: aerobic activity, or cardio, strength or resistance training, and balance and flexibility. Try to make all three of them part of your life. Aerobic activity is any physical activity that gets your heart rate up, such as walking, biking, jogging, swimming, dancing, or cross-country skiing. For Indigenous people and others who enjoy connecting with the land, traditional activities like fishing, hunting, trapping, or harvesting are excellent forms of aerobic activity. They not only support your health, but also provide a deeper connection to culture, family, and nature. We recommend you do at least half an hour of aerobic exercise 5 days a week. You can work up to it gradually over time. To avoid injuries, always warm up before you start exercising and cool down afterwards. A good warm-up is walking or cycling slowly for 5 minutes. Start off your exercise slowly, then gradually increase the activity to a steady, moderate pace. Remember, the talk test, you need to be able to talk, but not sing or whistle during your exercise. At the end, take 5 to 10 minutes to cool down before you stop and do some gentle stretching. Gradually slow your pace to let your heart rate go back to resting levels. For example, if you are going for a run, gradually slow down at the end and then walk instead of abruptly stopping. Strength training, also called resistance activities, improve your muscular strength, muscle mass, and endurance and bone health. Some examples include lifting free weights, using a resistance band, using a weightlifting machine, or body weight activities like squats, lunges, or push-ups. Cultural activities and practices can be integrated into your strength training routine. For example, lifting or carrying are common strength training movements that often accompany cultural activities for some First Nations and Métis people, such as fishing, canoeing, or harvesting. These activities not only strengthen the body, but also help maintain your connection to the land and your heritage. For everyone, it's important to start slow and build up gradually to avoid injury. Aim to do strength training activities 2 to 3 days per week. If you're new to strength training, ask your healthcare provider the maximum weight that's okay for you to lift. They can help you develop a safe and effective plan that fits your abilities and lifestyle. The goal is to support your body so you can stay active, independent, and connected to the things you love. It might take a while to find the right balance between activity and rest. Don't give up. Remember that any amount of physical activity helps, and including family and friends can support you.
How does heart failure impact sex and intimacy? Sex and intimacy are important parts of a healthy and meaningful life for many people. Living with heart failure doesn't mean you have to stop being intimate. It just means learning how to adapt and listen to your body. Sex is like any activity that makes your heart work harder. For example, sexual intercourse uses the same amount of energy as climbing 2 flights of stairs. Masturbation or manual or oral stimulation may require similar or slightly less energy. You can use the heart failure zones and the talk test to make sure that your level of effort is okay. If you or your partner have any concerns about sex, talk to your healthcare provider. They can give you advice and information about treatment options. There are a few different ways to make intimacy easier on your heart. For example, choose a time when you're in the green zone and you feel relaxed and well rested. Avoid sexual activity if it's too hot or cold, you are under stress, or you have just had a meal. Avoid alcohol before sex. Pay attention to how you're feeling. If you have any new or worsening symptoms, stop and rest. Being physically affectionate and connected in other ways like kissing, cuddling, or holding hands can also strengthen your connection and provide emotional closeness.
Do you engage in physical activity on a regular basis? And if so, which ones?
Yes, I do. And all the activity I do, I really love doing it. Okay, I think that the most important ones is sort of related to yoga, where I have a full body routine that I've been practicing for years, but I do it slower. Mm-hmm. And I guess my favorite one is walking. Nothing like getting an umbrella and putting a jacket on and getting out there in the rain and listening to music from my cell phone and my earpods. I mean, it's really a great experience.
And how much walking do you normally do throughout the week?
At least 3 good walks a week, depending on how I feel at the time. But it takes me a lot longer. Like where I used to be able to do a 4-kilometer walk in about 35 minutes, now it might take a couple of hours. Mm-hmm. But during the walks is where you're able to get sort of into wellness, drift off a little. Physical activity is probably the most important thing you do in order to feel good and to maintain health.
After you were diagnosed with heart failure, how did you feel about engaging in exercise?
Actually, a little scared. When I was told by the doctor that I had lost a certain part of the function of my heart, it was a difficult thing to try and put in what type of exercise can I now do.
And what made you overcome these feelings to return to physical activity?
Actually, working with my nurse practitioner, Rashima, who went through a lot of discussion, like it was a fabulous kind of session. And also with my cardiologist, who kind of said, do anything, providing none of the yellow zone shows up. And I think that brought me back into looking at activity and bringing it down to my new self.
How has physical activity positively impacted your daily life?
I think more in attitude. It makes you feel good. It makes you feel relaxed, and it makes me feel as though I don't have a heart problem.
What advice would you give to others living with heart failure about intimacy?
Don't worry about it. Intimacy takes many shapes and forms, and it's a very individual thing.